Thanks for the welcome, and thanks for all of you taking time out of your incredibly busy days to be here. I promise to keep my remarks brief. I have a number of key messages that I'll just sort of buzz through. I think some of them will stick on this topic of healthcare and where this concept of the patient-centered medical home fits in and how it affects what we're trying to do in the state in terms of achieving healthcare and health outcomes from a public health perspective, as well as managing costs and the state budget issues. It's all sort of tied together. So I'll hopefully plant a few seeds, many of which could be the subject of much bigger discussions. Coming from a corporation that I work for, to speak from employer or a business perspective, what do employers want and what really helps with economic development and business growth? It's the need for achieving better health, which is sometimes referred to as population health, better care, which is about the way the patient's experiences as well as quality and safety, and then better value and how do we get more for less money and control the costs of care. And so we're trying to achieve those things, but there's huge gaps between the status quo and where we want to go. And you might say, well, what's the problem with the cost of care? And you probably hear about this all the time, but in case you haven't seen this 25 or 30 times already, the cost of health care continues to go up, and it continues to consume every year a greater percentage of the gross domestic product and the total federal budget as well as state budgets. State budgets today, I believe on average, about 40% of the state budgets are supporting healthcare programs with Medicaid primarily. That's a big deal, and it gets bigger all the time. So we have this escalation which is going up at a rate much higher than overall inflation. So on the lower part of this graphic, you can see that's the general rate of inflation, or and the rate at which workers' earnings are progressing. The upper part is health insurance premiums tracking right along with the general cost of health care. So this is an ongoing problem that doesn't seem to have an end in sight at the moment. It's been going on for quite some time, and there's really two issues related to cost. One is that we're having a negative impact on earnings and jobs by the fact that this is a significant drain and challenge for businesses. The second is that it's creating issues as we're trying to manage budgets. So we're constantly grappling with that. And it's at the federal level and it's at the state level, and you're probably all aware that the federal budget deficit challenges that we're grappling with right now in the nation are in large part being driven and expected to continue to be driven by the costs that are associated with Medicare and Medicaid growing at a much faster rate than even Social Security. Okay, so here's a graphic that I think explains an awful lot in one picture, and if you get this picture, it'll stay with you and help you with the judgments and the decisions by large part. So where does money come from? Generally from business and industry. It's paid out in wages, and it goes into a common pool of resources in terms of taxes. So we have as a society this thing called the common pool. And so we have this common pool, and those common pool of resources which you're using at a federal or a state level get allocated out to a number of things. You can take the healthcare piece and break it down. It gets allocated out to lots of pieces. But that same pot is where we draw money from for education and for infrastructure issues. Not that that's the sum total of everything that happens, but just trying to use this as an illustration. So sometimes we think of these things as separate issues, education or healthcare or infrastructure, but in many ways they're tied, because the picture that we just showed with the healthcare costs going up and up and up, that means that every year the percentage of this common pool or pie that we have gets bigger for healthcare. And therefore, by definition, the pool for education and infrastructure gets smaller. And so they're not really independent issues. They're tied together because of this. And so just from a concept perspective, I think this is an important issue. The other interesting thing is if you understand what really drives health, education or socioeconomic status is a key driver of health. So we're eroding our capacity to really make an impact on health by diminishing education and some of those other social services. Common term for this is like social capital erosion. So we've got this interesting cycle going on which undermines our ability to achieve health outcomes from a public health perspective. These reports come out with great regularity, chronicling the amount of waste in the system. So if we could just even address the waste, we would be in a far better place, and without having a negative impact on anyone's actual health. So that's what I see as the issue with cost. One of the three things that employers are caring about. If we look at what's the issue with health, we've got, despite all the money we're spending, we are, at the same time those costs are going up and up, the health outcomes in general are diminishing. So this is a epidemic picture of what's happened in our lifetime in terms of obesity and diabetes just since 1994 to 2009, and that never before have we seen such an experience in our population in such a short time. And our health outcomes on a broad set of metrics, not just these two from developed countries, illustrate that we're doing rather poorly compared to other industrialized countries on quite a broad range of health outcomes. The Trust for America's Health most recent report in September shows that if obesity rates continue on those current trajectories, that by 2030, 13 states could have adult obesity rates higher than 60%. And the medical costs associated with treating that are going to be a multiplier on the cost problem that I just illustrated. So we've got a health issue and we've got a cost issue. And I mentioned there's a concern about care and why do we care about this patient experience or the safety and quality issues. We know that one of the, within the top 10, imagine this, that medical errors in the hospital are one of the top 10 causes of death. Arguably, maybe the fourth to the fifth or sixth leading cause of death. I mean, it's hard to appreciate how significant that is, the number of people. And even those people who don't die from mistakes in the healthcare system, there's hundreds of thousands that are having an adverse health impact less than death. So this is a very significant issue. Now I mentioned that there's a lot of things that contribute to the outcome of health. If you were to take an entire population and say, how do people get healthy? And what drives that? Well, this graphic is produced by the CDC, the Institute of Medicine. They all have their version plus or minus a couple percent, but it's pretty common. About half of what creates health is the choices that an individual makes in terms of their lifestyle. The healthcare system that we've been talking about, where we're spending all this money, contributes about 10% of the total impact to the achievement of health. And the environment that people live in and their genetics are the other components. But a huge amount of this relates to what we do in public health in terms of supporting people in good choices. Education drives a lot of these decisions, and I showed you how the money we're spending on health diminishes the money we have for education and the money we have for wages, which really are much bigger factors on achieving public health objectives for the population than the healthcare system. But we're taking money routinely away from all of those things. Then if we look at another report from this past year from the Robert Wood Johnson Foundation, by working with physicians in a broad range of healthcare providers, has chronicled the fact that social support systems are really important to the achievement of health. And unmet social needs are causing worsening health. And we have unmet social needs, which are the frequent cause of rehospitalizations and other issues. So we have to be thinking in terms of this whole picture when we're addressing policy and that. So we have a really unsustainable system here that is sort of like the perfect storm going on with health issues and cost issues. And we really need to think about this to find a way out. So as I mentioned, we've got to solve this equation with three variables. So we've got to get better health, better care, and better value at the same time. And what's the barrier to that? And I would contend that it's the system that we're using, that we pay for volume, not value. We have a huge waste and inefficiency, that patient safety and quality challenges are significant. We have major issues with fragmentation and lack of integration in our system. And those things that really drive population health are becoming less effective because we don't have the capacity to fund them by this diversion of resources. So I'm getting to the main story here about the patient-centered medical home. And why is that of interest? And the reason is because although I would never claim that it is a silver bullet or it solves all things, it has great promise to address all three of these issues simultaneously, which is what I was setting up is you got to solve all three. And why is that? Because it addresses systems issues, links in total care around the patient, links in bringing in networking of the patient-centered home, the medical neighborhood, and it aligns priorities to create a framework that has the possibility of addressing all of these. So today, what's the issue with our system? The issue with our system is it's not a system, in that we don't really have a system. We have a lot of pieces, but they're not a system. And what happens with the medical home is you begin to lay the cornerstone of a system. And that's why it is a promising opportunity, that it begins to solve this system issue. And you can do this at a local level and begin to make a change in a single community, in a region, or in a state. And that the possibility is there to solve what is arguably a huge national issue at a local level. So in summary, this phraseology of the triple aim is exactly what I've been saying. You want better health, better care, and better value, or population health, patient experience, and cost of care. It's just different phrases. The patient-centered medical home has elements that could be a major turning point in helping to solve this. And there's a lot of powerful forces for change. The World Economic Forum has a statement that I think is quite appropriate to this situation. They say that the complexity and the magnitude of this problem is so large that it will require the mobilization of all social forces to solve it. It's not like you could just say, well, let somehow this part of industry figure it out, the healthcare system by themselves, or let certain policy actions happen. It really needs us to come together.